we are looking at the state of the air. The American Lung Association recently released its 2025 State of the Air report, and the outlook isn't looking all that great, especially for people of color. So here to share more about the findings, we have the National Senior Director for Policy with the American Lung Association, Katherine Pruitt. Thank you for being here on Great Day.
It's my pleasure. Thank you for having me.
Of course, it doesn't look good. Is that what the report showed, or is it for different areas?
Well, it does vary depending on where you live, but nationwide, it wasn't the report looked pretty grim.
Really?
Yes.
Especially from previous report 2024, we went the wrong direction?
Yes, yeah.
Okay, all right. How did we rank here in the DMV?
Well, so nationwide, we found that 156 million people were living with unhealthy levels of air pollution. That's nearly half of the U.S. population.
Wow.
A lot of places got worse, including the DMV.
Okay.
Yeah, we're not in the worst of the worst. We always include in our report the worst 25 cities for each of the pollutants that we measure. And fortunately, we didn't make those lists, but we're not too far behind.
Okay, so we're not the top 25.
No,
no. We're right behind it. And we said in the introduction, it's actually worse for people of color. Why is that? Why are they seeing higher rates?
Well, we know that people of color are disproportionately at risk of health harm from air pollution, partly because they're more likely to live in places that have higher levels of pollution. And again, nationwide, people of color are about 41% of our U.S. population, but they're 50% of the people that are living with failing grades for air pollution.
Wow.
And that's compounded. The fact that they're more likely to be exposed is compounded, then their risk is compounded because they're also more likely to be living with some of the chronic conditions that make them at higher risk of health harm from the bad air that they're breathing.
Is that like having asthma?
Asthma, diabetes, heart disease, yeah.
Okay. Yeah, what makes you more susceptible if you're in one of those groups, that the air around you not being good? How does that hurt you?
There are a couple of factors in our lives that affect how likely we are to suffer the health harms from air pollution. One is how much you're exposed. So if you're living in a really polluted place, or you're spending more time outdoors, if you're an outdoor worker, an agricultural worker, a kid out playing, so more likely to be exposed. Having an underlying health condition that puts you at higher risk, like asthma, COPD, heart disease. If you don't have access to health care, which unfortunately a lot of people don't, that means if they are exposed to air that makes them sick, they don't have a way to keep from getting worse.
Right.
And then the last factor is the kind of social stresses that put a lot of demand on someone's body. If they're living with levels of violence or noise or other chaos in their lives, that increases their risk.
Yeah. This sounds very bleak. I feel like the whole report, right, when it came out. Is there anything we can be doing to help this? Is that the message right now, to make this better? So next year when you have the State of the Air report come out, we're saying it got better this year.
Yes, there are.
Okay.
The Clean Air Act has been around for 50 years, and we've made a lot of progress over that period of time. The rules and the cleanup mechanisms that we put in place are really helping. But now we're at a place where the heat and the drought and the wildfire from our changing climate are starting to make things worse again. So that's really where we need to focus. We tell people to protect themselves first, know what the quality of their air they're breathing is, do what they can to reduce their own contributions to air pollution. Then that there are lots of steps that you can take.
I know there's so much more information that you have already posted. We can go to lung.org. Is that the best place?
lung.org/SOTA, State of the Air.
Okay, see that State of the Air and see what we can be doing. Thank you for being here. We appreciate it.